knock. Good morning, Mr. and Mrs. Smith. My name is Robin. I'm a BCIT student nurse, and I'm going to be your nurse today with you and your newborn. How's everything going so far? Good. So I'm assessing his need for safety. Everything is safe, and I'm ready to proceed. Okay, how did you guys sleep last night? Great. And then is there any immediate concerns with the newborn themselves? No? Okay. Okay, sounds good. So what my job here is to do today is to just do a newborn assessment. And then I'm also going to incorporate you guys with some teaching and just some things to also look out for you as well. So what we're going to do is I'm just going to start with the vital signs for the baby, okay? So what I'm going to do is I'm going to take a heart rate, I'm going to take a resp rate, and I'm also going to take a temperature. For the heart rate and the resp rate, I'm going to listen for 60 seconds. The heart rate should be between 100 and 160, and the respiration should be between 30 and 60. So I'm going to take a listen to your heart now, okay? All right, listening for a full 60 seconds. Okay. And then for this demonstration purpose, we will just do not the full 60, so we will say the heart rate is 140 beats per minute. Now I'm going to listen to the resp rate. And again, we'll be listening to the resp rate for a full 60 seconds. Great, so resp rates are easy and unlabored, and we have a resp rate of 52 breaths per minute. I'm also just going to take a listen to your bowel sounds, your baby's bowel sounds now, while I just tap the stethoscope on me, okay? And we have bowel sounds in all 4 quadrants. That's very good. Now I'm just going to take this little temperature thing and we're just going to stick it underneath your baby's armpit and we're just going to hold it there till it beeps, and that's going to be our temperature. So we'll say it beeped there. Great. We have a 36.8 temperature, which is normal. Okay, Mom and Dad, now I'm going to do the newborn assessment. You are more than welcome to take part and engage with me and ask questions, and I will provide teaching throughout the newborn assessment as needed, okay? Okay, so we're going to start with the baby's head. Just going to look for the baby's head here. Just going to make sure that everything is all normal. Okay, so I'm going to feel the front fontanelle and the back fontanelle just to make sure that it's all symmetrical and it's round and everything is good. I'm going to take a look at the ears here now. Make sure that the ears are all intact and normal. Sign of a teratogen exposure is a little clip at the top of the ear. We just want to make sure that's not there too. Additionally, we want to look now at the eyes. Are the eyes symmetrical and all normal and round? Yes. Are they in direct line with the ears? Yes, they are for this baby. We're also going to look at the nose now and see if they flare. The nasals do flare, which is normal. And we don't have any presence of a cleft lip. And now we're also going to take a look in the mouth of the baby. And the mouth is moist, mucous membranes are moist, and it's red. And when I go like this, the baby does show the rooting reflex. Okay, great. So now that we've done the baby's head, we're going to move down to the chest. I'm just going to assess the symmetry of the chest, how the breathing is working, and to make sure that both sides of the chest are going up at the same time at the same rate. So this all looks normal to me. Okay, now we're going to move down to the bowels, okay? So I already listened to the bowel sounds, and they did work very well. Everything is working. They are active in all 4 quadrants, okay? Now I also just want to take a look here at the baby's skin. So we're just going to observe first, checking for redness, signs of perfusion, which the baby does look perfused. We'll take a little cap reflex or cap refill, pardon me, and this just makes sure that the blood is able to get back into where we push. So baby looks perfused. I don't see any signs of jaundice. The eyes don't show any signs of jaundice for me, so that's good. We also want to take a look at the skeletal outline of the baby too, and just make sure that everything is, symmetrical and correct. So I'm just assessing the arm, abdomen, torso, and legs, and it does look symmetrical, and all this, there's no bruising and no marks on the baby. And I'm also going to assess now the reflexes. So we're just going to do the Babinski reflex. Gonna go like this, and the baby's legs are going to contract. Go like this, baby's feet will contract. Additionally, we'll do the rooting reflex, and this will make the baby turn to where they're being touched, and they think it's a nipple to feed. Okay, so we'll say the gender of this baby, or the sex, pardon me, more so, is going to be female. So I'm just going to assess now the genital area. So assessing for any rashes, any swelling. Swelling is normal in females. The labia majora will swell, and that's totally normal. And having rashes in your baby is also normal too. Okay, great. So that's all good. Now for peeing and pooping, voiding. So babies, how has the baby been peeing? Good, we've had a pee today. Great. How's the baby been pooping? We had a poop today. Great. And today's our first day, right? Wonderful. So what you'll see, we'll provide some education here for you. What's common you'll see is a kind of a black tarry stool. We call it Menochium in nursing, and this is just kind of like the black tarring. It's normal for the first 1 to 2 days. After that, you'll start to see more of like the greeny yellowy stool, and that's where it'll get more so normal. The way the baby is going to pee and poop is going to be consistent with the days. So day 1, you'll have 1 pee, 1 poop. Day 2, you will have 2 pees, 2 poop. Day 3, 3 pees, 3 poops, and so on. Okay? So anything you just want to be watching out for the baby is any signs of constipation if the baby's not passing stool, or if the stool is a reddy color. You also might want to check out with your family practitioner about that. And then cord care. Also, we're going to provide some education on cord care here. So cord care, what we're going to want to do is that when you put the diaper on the baby, just make sure that it's folded over the actual cord itself. This is just to protect it. The cord will fall off on its own. And what might happen when the cord falls off is it might have a little bit of blood or a little bit of blister, that kind of stuff. That's all normal. Okay? And then some things for the cord as well, because it is going straight into the baby's body. It is a wound, technically, so we just want to make sure signs and symptoms of infection. So such as redness, swelling, any pain here, or any heat for the baby. That's really what we want to be looking for, okay? Now we're just going to flip the baby. I just want to take a look at its spine. So I'm assessing the baby's spine and the curvature. It's all straight and all good. Great, I'm also going to assess the bum for any Mongolian spots. And there are none present on this baby. Great. Now, Mom, how often are you feeding the baby, and how are we feeding this baby? You're breastfeeding exclusively, okay? And how's your latching been going for you? Good. Baby's been latching, no problem. Any blistering, anything at the nipples there? No, and you feel like the sucking, and you can hear the baby going, ka, 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 and that's that they're actually getting the milk? Yes. Okay, great. And then how are you guys doing with responding to the baby's cues? So you know that there's like an early cry and an intermediate cry and then kind of like a last resort cry. So when you start to see your baby kind of getting fussy, you know, starting to like move its head a lot, when it starts turning its head a lot, that's rooting. It's looking for a nipple. So just signs to look out for is stuff like that, but it sounds like you guys are doing a good job. But yeah, so just make sure the crying, screaming, crying is usually the baby's last phase. They've usually tried every other option first, okay? Okay, well, you know, you guys have a beautiful baby girl, and congratulations, and everything looks good to me, okay? All right, if you have any questions, I'll be around, and my name's Robin again, okay? Okay, have a good day, you guys. Bye.